Hey fellow lab rats, this is Rebecca from the Lab Rat YouTube channel. In this video, I'm going to be discussing dermal punctures. All right, let's get started. By listening to this presentation, you'll be able to state the complications associated with the puncture of deep veins in infants, list the reasons for performing dermal punctures, and explain why certain tests cannot be performed on capillary specimens. You'll be able to describe the composition of capillary blood, describe the types of equipment needed for the collection of a dermal puncture specimen, as well as identify acceptable sites for performing dermal puncture. You'll be able to discuss the purpose and method for warming the dermal puncture site, state the complications that may result from the presence of alcohol at the puncture site. You'll also be able to state the correct positioning of the lancet for dermal punctures. You'll be able to name the major causes of capillary specimen contamination, state the correct order of draw for capillary specimens, and describe the correct labeling of these specimens. In addition, after listening to this presentation, you'll be able to discuss the necessary precautions for collecting acceptable newborn bilirubin specimens and discuss why and how newborn screening tests are collected. There are also several key terms associated with this lecture. They are arterialized, calcaneus, congenital hypothyroidism, cyanotic, cystic fibrosis, dermal, ecchymosis, galactosemia, iatrogenic, interstitial and intracellular fluid, jaundice, osteochondritis, osteomyelitis, palmar, phenylalanine, phenylketonuria, and plantar. Now that we have discussed the learning objectives and the key terms for this lecture, let's get started. A dermal or skin puncture may be required when a venipuncture cannot be performed or may be the option of choice for some point-of-care test procedures. A dermal puncture may be a finger stick, or in the case of small infants, may be a heel stick. Dermal punctures are the method of choice for pediatric patients. They can be used in adults with specific situations like those that are severely burned or scarred, are on chemotherapy, or have a tendency for clotting. Dermal punctures can also be used for elderly patients that have very fragile veins and those with inaccessible veins. Also on obese patients where it's difficult to find a vein, or patients that are really apprehensive about getting their blood drawn. Dermal punctures can be used for glucose point-of-care testing as well. So this is a glucose level that is taken and tested by the patient's bedside, like with a glucometer. So why don't we just use dermal punctures for every blood test rather than using venipuncture? So there's a number of reasons for this. So first, dermal punctures provide a much smaller volume of blood than a venipuncture procedure does. So some tests just require more blood than a dermal puncture can provide. Also, a smaller amount of blood collected can lead to a higher risk of contamination from the skin. Microclots are small clots that can form in the sample if the procedure takes too long, and this is common in dermal punctures as a finger or heel stick will have a much slower flow of blood than in a venipuncture stick. Some samples, like those in purple tops, cannot be clotted even if it is collected via dermal puncture, so those microclots cause a problem. Hemolysis, which recall, is the red blood cells breaking open causing a red tint to the serum or plasma, which of course causes inaccurate test results in certain tests. There's a higher chance of hemolysis in dermal puncture samples versus venipuncture samples. This can be caused by excessive squeezing of the dermal puncture site, not allowing the alcohol on the skin to dry properly after cleansing, too vigorous mixing of the microcollection tubes. Also, again, dermal punctures are the sample of choice for newborns, but newborns' red blood cells are more fragile than in adults, and so they hemolyze much more easily. So dermal punctures are not always appropriate for certain circumstances and are not the ideal specimen for patients that are dehydrated. Blood from a dermal puncture comes from arterioles, capillaries, and venules, but the composition of blood more closely resembles arterial blood due to the pressure in the arteries. The normal laboratory values are based on venous blood samples, except for arterial blood gases, which require an arterial puncture, which is performed by a respiratory therapist, not a phlebotomist. Arterial blood, which is blood from the arteries, has a higher concentration of oxygen and lower levels of carbon dioxide than does venous blood. Fluid that is around the cells and the tissues is called interstitial fluid, and this fluid can dilute a dermal puncture sample. Intracellular fluid is the fluid inside the cells. If red cell lysis, or break open, then this fluid can contaminate the plasma sample and cause the lab values to be invalid. There are many types of dermal puncture devices. Most of these are automated so that the depth and width of the puncture is standardized and controlled. There are also many types of micro collection containers. The collection containers are also color-coded like those vacuum tubes are. So as you can see on the photo on this right-hand side of the slide, this one is green, so it contains heparin. A glass slide is used to make a blood film for viewing under the microscope, but these are usually made by laboratory personnel from a purple tube. A heel warmer should be used to increase the blood flow for an infant. If a heel warmer is not used, then the blood may not flow adequately enough to collect an appropriate amount of blood. The width of the puncture should not exceed 2.5 millimeters, and the maximum depth is 2 millimeters for heel sticks. If an infant is premature, a smaller depth should be used. The devices are color-coded to designate the depth of the needle. The automated devices will retract the blade into the device, but they must be still placed in a sharps container after they are used. The device should be selected based on the age of the patient and the collection site, as well as the amount of blood that is needed. The photo on the right-hand side of this slide shows an example of a puncture device used for dermal procedures. This slide shows two more pictures showing examples of the types of puncture devices used for dermal punctures. To produce adequate blood flow for a dermal puncture procedure, the depth of the puncture is much less important than the width of the incision. This is because the major vascular area of the skin is located at the dermal subcutaneous junction. This junction is located under 1.6 millimeters below the skin in a newborn patient and under 3 millimeters below the skin in an adult patient. Dermal puncture devices can reach this area pretty easily. The amount of blood that flows from a puncture is based on how many capillaries are severed with the width of the puncture device, so not how deep it goes, but what the width is. This photo shows the vascular area of the skin. The epidermis is the outermost layer of the skin. The dermis is the inner layer of the two main layers in the skin. It contains tissue, blood vessels, sweat glands, nerves, and hair follicles. The capillary bed is an interwoven network of tiny blood vessels called capillaries that supply the skin with nutrients. The subcutaneous tissue, here at the bottom, is the deepest layer of the skin, made up of mostly fat cells and connective tissue. The dermal subcutaneous junction is between the dermis and the subcutaneous tissue, and you can see it here, this capillary bed here. So the width of this is how many capillaries are punctured, and that's how much blood you'll get out of a dermal puncture procedure. Capillary tubes are also called microhematocrit capillary tubes. They can be used to collect a small sample for blood gases or for determining the hematocrit. So the hematocrit is the percentage of cells in the blood sample. So examples of capillary tube are in the photo on this slide. So these are capillary tubes. So these are not used to puncture the patient, it's just to collect the blood that comes from the dermal punctures. There are many types of small collection containers that can be used to collect blood from a capillary puncture. Those with anticoagulants, such as the purple or the green tops, must be mixed. A picture of a micro collection container is on the next slide. So here it is right here. So when collecting a micro collection tube or a micro container, it should be slanted downward to allow blood to run toward the bottom of the tube. The collection tip should be placed beneath the puncture so that it touches the underside of the drop of blood. The sample may have to be mixed during collection to prevent clotting if the process is too slow. The tube must be filled to the required line, as tests cannot be performed unless the minimum amount of sample is collected. Small capillary tubes may be placed into a secondary container. Labeling requirements are the same as they are for venipuncture. A tube extender can be attached to some brands of these microcontainers so that a full-size label will fit on the container. Warming the puncture site increases blood flow significantly. If the phlebotomist does not have a commercial heel warmer, like the one pictured on this slide, the phlebotomist can use a glove filled with warm water or a warm cloth. The temperature of it should not exceed 42 degrees centigrade or Celsius, which is converted to Fahrenheit, it would be 107.6 degrees Fahrenheit. So if it feels, just in general, if it feels too hot for the phlebotomist, then it is too hot for the patient. There must be a test order before a dermal puncture procedure is performed. The phlebotomist should observe isolation procedures to protect the patient and themselves. Proper patient identification is vital in preventing medical errors. An adult should be seated or lying down with their non-dominant hand fully supported. An infant patient should be held by an adult or laying down on its back with the heel lower than the torso. Now, once a child has started to walk, a heel puncture is not advised and a finger stick or venipuncture should be performed. The correct site for heel puncture is the medial or lateral plantar surface of the heel. This area is indicated by the pink areas on this picture of the foot. So let's see, this area here. So all of that there is considered acceptable for a heel stick. Now, notice this white circular area on the foot, which is right here, okay? So that is the calcaneus bone, and the area above or on that calcaneus bone must be avoided when doing heel stick. So if this bone is punctured by the puncture device, it can cause a serious infection within the bone. Other areas of the foot are not acceptable as damage to nerves, tendons, or cartilage can occur. Once a child is over 1 year of age or has started to walk, a finger stick dermal puncture should be used instead of a heel stick. Depending on the child's veins, venipuncture with a parent holding the child may give a better sample and may hurt the child less. The puncture should be on the palmar side of the non-dominant hand on the third or fourth finger. Now, for reference, the thumb is digit number 1, so you want to use the third or the fourth digit. The puncture should be made perpendicular to the patient's fingerprint, not parallel to prevent blood from running. The depth of the lancet used is based on the size of the finger. A heavily calloused finger cannot be used. A finger that is also too small should not be used. The index finger should not be used to prevent nerve damage, so it should be the third and the fourth fingers. The phlebotomist should remember that they should not puncture through a previous site, a finger that is swollen, calloused, scarred, cyanotic, which is like kind of either white or blue in color, or a bruised finger. Blood should not be collected on the side of a mastectomy without physician approval. The same antiseptic that is used for venipuncture is used for dermal puncture, which is a 70% isopropyl alcohol. The procedure for cleansing the area is the same. The area is cleansed with the alcohol wipe, allowed to air dry. And once it's cleansed, that area cannot be touched again except for with a puncture device. If the alcohol is not allowed to dry on the finger or the heel stick, the sample, the alcohol is not allowed to dry on the finger or the heel, the sample can be contaminated or cause the patient to feel a burning sensation. After the heel or finger have been warmed and been cleansed with an alcohol wipe, the next step is to massage the area, hold the area to puncture it, and then dispose of the lancet in a sharps container. The first drop of blood can be contaminated with alcohol or tissue fluid. Because of this, the first drop of blood should not be used for testing and should be wiped away. The phlebotomist should alternate between pressure and relaxation on the heel or finger. They should not scrape or touch the puncture site with a collection device. To avoid air bubbles and capillary tubes if they're used, the phlebotomist should hold it horizontal and just slightly down at the end away from the collection site. The order of draw is not the same for dermal punctures as it is for venipuncture draws. The capillary blood gases are collected first, then blood smears, then EDTA tubes, so these are either pink or purple, other anticoagulants, gray tubes, and then serum tubes such as red or gold tops. Phlebotomists will need to know both orders of draw by memory, so both the dermal puncture order of draw and the venipuncture order of draw. For bandaging a dermal puncture, the phlebotomist should apply pressure and have an adult patient hold pressure and elevate while the phlebotomist labels the tube. Then they can bandage. For an infant, the phlebotomist should hold pressure until the bleeding stops. A bandage should not be used on a child under age 2 as they can be a choking hazard. If a patient has sensitivity to bandages, the phlebotomist should use paper tape or just maintain pressure until the bleeding stops. The same labeling requirements apply to dermal puncture samples as does venipuncture samples. Capillary tubes are too small for this information to be written on, so they can be placed in a larger tube with the labeling requirements. Microcollection tubes are also small and may not fit all the required information on them. There are tube extenders for microcollection tubes, and these tube extenders can have the patient label put on them. Newborn bilirubin tests are a common test performed on infants. Bilirubin is created from the normal breakdown of red blood cells. Infants sometimes will have increased bilirubin levels due to hemolytic disease of the newborn, or more commonly when the liver is not developed enough for it to properly remove enough bilirubin. Bilirubin has a yellowish color to it, and when there are increased levels in the body, the patient can appear as something we call jaundiced. So this is a yellowish tint to the skin. An increased level of bilirubin in newborns can cause brain damage, so it's important for doctors to monitor the bilirubin levels. When there is an order for bilirubin testing, the sample is collected in an amber microcontainer tube to protect the sample from light. This is done because light breaks down bilirubin. So if not collected in an amber tube, there could be a falsely decreased bilirubin level, and these false results would negatively impact the patient. Newborn patients with high bilirubin levels will often be placed under a UV light, which helps to reduce those levels. This light must be turned off when bilirubin samples are being collected. The samples must be collected at specific intervals to determine if the bilirubin is decreasing as it should be. Critically high levels of bilirubin may require the newborn to get a blood transfusion. Newborn screening for genetic, metabolic, or hormonal disorders is mandated, so that means it's required. This is because early detection can prevent physical or mental disabilities if proper nutritional or medical intervention is started immediately. This testing is done after the baby is 24 hours old, but before they leave the hospital. This photo on the right-hand side of the slide shows a newborn screen being performed. The newborn gets a heel stick, and the blood is put on a special testing filter paper. There are a few circles located at the bottom, as you can see in this photo, and these circles need to be completely filled with the baby's blood from a heel stick in order for the screen to be properly performed. One of the disorders that a newborn screen looks for is phenylketonuria, or PKU, and this is caused by the lack of an enzyme that metabolizes or breaks down the amino acid phenylalanine. The phenylalanine, because it is not being broken down, will accumulate and cause problems with brain development, which results in physical, mental, and social skills delays. Early detection is crucial because the damage is not reversible from PKU, but the disease can be treated with a low phenylalanine and high tyrosine diet. Another newborn screening disorder test is congenital hypothyroidism. This is a thyroid hormone deficiency that's present at birth, and this deficiency can cause delays in growth and brain development that produce physical and developmental abnormalities, which can be avoided by using oral doses of thyroid hormone within the first few weeks of being born. Galactosemia is a genetic metabolic disorder caused by the lack of the liver enzyme that converts galactose, which galactose is a sugar in milk, and it converts galactose into glucose. So because this enzyme is deficient and it's not breaking down galactose into glucose, this means that galactose is going to accumulate in the blood. And this can cause an enlarged liver, kidney failure, cataracts, blindness, and even brain damage. So treatment for this disorder is just a lifelong elimination of all milk and dairy products for the patient. So galactosemia is another disorder that the newborn screen detects. Another newborn screening disorder is cystic fibrosis, or CF. And CF is an inherited disorder caused by a genetic mutation that affects the transport of chloride across cell membranes. So secretions of thick mucus that are produced from this mutated gene build up in the lungs and organs of the digestive system. It causes breathing disorders, infections, and malnutrition. So treatment of cystic fibrosis includes mucus thinning medicine, bronchodilators, and antibiotics when they become infected. Unfortunately, patients with cystic fibrosis have a shortened life expectancy, usually not living beyond the age of 30. Now this shows acceptable and unacceptable filling of the filter paper circles for the newborn screening test. The circle on the filter paper needs to be completely full of blood, like shown on the leftmost circle. Remember that the blood will usually be over the line and not exactly in the lines like this image shows, but the circle must be full. The following are reasons why a newborn screening specimen may be rejected. If the quantity is not sufficient, so QNS, so this may be caused by just not filling the circle with enough blood, or if the paper was contaminated by gloves, powder, or lotion. If a capillary pipette is used to fill the circles of the test, this may cause scratches on the filter paper circles, causing it to be rejected. If the sample is not allowed to properly dry before it is mailed, this can cause rejection. Newborn screening samples need to be dried for a minimum of 3 hours before they are mailed out for testing. Newborn screening tests may be rejected if too much blood is put onto the circles, so an oversaturation. If the sample is diluted, discolored, or contaminated, serum rings present on the sample will cause rejection as well. So this can be caused by not allowing the alcohol to dry in the skin before performing the puncture, contaminated filter paper, milking of the blood onto the filter paper, using a capillary pipette to fill the circle with blood, or improperly drying the sample. Lastly, if the newborn screening test area is clotted or layered, so this will cause it to need recollection. So this can be caused by using several drops of blood to fill the circle, or applying blood to both sides of the filter paper to fill the circle. Okay, so this concludes the lecture on dermal punctures. If you like this video, please hit the like button and make sure to subscribe to my channel for more educational laboratory content. As always, if you have any questions about this lecture, please leave them in the comments below. Until next time.